Valley Care becomes the first in California to use an artificial disc in spine surgery. Well, over half the people over age 40 suffer from cervical disc disease. The disease can range from chronic neck pain to paralysis. Well, surgeons from the Northern California Spine Institute in Pleasanton have tested the revolutionary procedure on a patient at Valley Care Medical Center this morning. 580 680 News reporter Mariella David has the latest.
Staff at the Pleasanton-based Northern California Spine Institute have much to be proud of. This morning, two surgeons from the institute, Dr. Kevin Booth and Dr. Joseph Grant, earned the honor of being the first in the western half of the United States to perform a revolutionary surgical procedure aimed to help those who suffer from cervical disc disease, which wears out the discs in the neck and can cause a variety of problems.
So it can run a whole gamut of problems, the least severe being maybe just some neck pain to the point of arm pain, weakness, and then eventual, partial paralysis. So that's the spectrum that we'll see.
Dr. Booth says the new surgery is better than the traditional method, which involves what's called disc fusion. He says one of the problems with this procedure is that it restricts patients from moving their neck.
This metal plate up top is the traditional way of doing a fusion, where the disc is removed and then it's bridged by a metal plate, which is very rigid and ideally prevents any motion.
Dr. Booth also says fusion puts stress on surrounding discs, which means more problems in the long run.
If you think of a trailer behind a truck that has 4 tires and you suddenly take away 1 tire, the 3 are left to do the work, and that's what we do with a fusion. We take away one of the tires, essentially.
So in other words, they are going to have problems with their neck, again, at another level.
But now, new technology allows surgeons to replace the injured disc with an artificial one, and that spells relief for patients. The artificial disc allows them to move their neck freely, which means less strain, less pain, and less visits to the doctor's office. The two call today's surgery revolutionary, saying the operation may become a standard practice in the future. But the true measure of success lies in patience.
We just saw the patient that we did this morning in the recovery room, and he's moving his neck quite freely and having no pain, and his arm pain is gone, and he basically is quite comfortable. So it is amazing. I think this will be a great procedure.
In Pleasanton, Mariella David, 580 680 News.
The new artificial disc surgery is yet to get FDA approval. The Northern California Spine Institute, along with 20 centers across the country, are simply testing the surgery to help the FDA determine if the procedure is safe. Both Dr. Booth and Dr. Grant say so far no complications have been reported and that the operation will most likely get the FDA's green light once patient results from the study are in.